What is a good first sign of glaucoma?
That's the scary part. There is no sign. Usually when the person or the patient notices a sign, it's already advanced and too late. So we always recommend, even if you've never wore glasses, come in and have a quick pressure check. That's what we're offering this Saturday. Basically, we'll check your vision, check your eye pressure, and we'll have 2 doctors on site that will look at the back of your optic nerve and let you know what they think.
Now, as I recall, I mean, growing up, I knew my grandfather had glaucoma and all that kind of stuff, and it used to freak me out because he'd be putting his eye drops in and all that stuff. And the times that I've been to the eye doctor in the past, wasn't the glaucoma test a little more complicated back when? But now it's kind of simplified.
It is. It is. Back in the day, we still have this machine just for a basic screening where we check the pressure with a puff of air.
Yeah, puff of air, and that's it. Just poof.
That's it. Yeah. Simple. If that reads high, then we do it a different way called applanation, which is with a little blue light. We put a drop in your eye, and you can't feel anything. It's very, very simple. But that's actually more precise.
Yeah. So you get a good reading with a little puff.
Exactly.
And then if it's something you need to look more nationally, how many people are affected by this?
2.5 million.
Really?
Mm-hmm. And locally, probably about 40,000.
If I were a guy that, and I'm starting to wonder, okay, what do I have going on here? What would I see first? Would it start to get cloudy? Does it get blurry?
Nope,
really?
It's not like that. With glaucoma, that's the scary part. It's called the vision thief.
Yeah.
The thing that people usually notice is peripheral vision loss.
Hard word.
It is, especially this early in the morning.
Yeah.
And then we usually detect it with a good comprehensive dilated exam.
Yeah, the dilated exam,
Exactly.
which is the one where you really can't see for like an hour or so.
But so important.
You gotta
Even
do
if
it.
you've never wore glasses, it's important to at least have a good dilated eye exam.
Talk a little bit about a cure. Is this something curable?
There is no cure.
Really?
It's not reversible. It is controllable. Based on what the doctor finds during that exam, we can start them on eye drops. There's occasional surgeries that can be done for glaucoma, but as far as a cure, unfortunately.
Is that the surgery where they kind of go underneath the cornea and they pull that little... No, that's cataracts.
That's cataracts.
That's cataracts. All right, so I'm getting the two confused because I don't know a whole lot about all this stuff. Because luckily, I've had some pretty good eyes, over the years. I had glasses for a little while when I was a kid, but I think it was more just like, let's keep up with the Joneses because everybody's getting glasses. And I didn't really need them.
That's the important thing with glaucoma or any of these screenings that we do. Even if you've never wore glasses and your vision's fine, it's very, very important to have a good dilated exam just to see if there's anything going on in the back of the eye.
How fast is something like glaucoma? How quick does it take over? Is it? I mean, it's progressive and it starts off, with a little bit. But is it something that goes really fast? Is it something that takes a while?
If it goes uncured or untreated, yes, it can progress fast.
And who is most at risk for glaucoma?
Patients that have a strong family history, so it's very important before you come in to check with everybody in your family, see if it does run in your family.
Yep.
African Americans.
Really?
People,
Really?
Mm-hmm.
That's
prominent. Very prominent.
No kidding.
Mm-hmm.
Huh. But the family history is a big thing, too.
Huge. And over the age of 40.
Yeah. Over the age of 40. Wow. I got 2 of the 3.
Well, you know where to come Saturday.
Maybe I should come Saturday and have a good look into this thing. Let's talk a little bit more about Shoreline Vision and what you guys offer too. You do the LASIK screening.
We do,
which is a huge way for people to get out of glasses and get their eyes fixed once and forever. Not everybody's a candidate for that.
Right.
How does it? And you do those throughout the year too?
We usually do 2 or 3 LASIK screenings per year. I love it. I've had LASIK myself. It's wonderful. To just be free of glasses. It's amazing.
I would freak out. I just get so nervous with anything around my eyes.
And that's normal. I work there, but we give you Valium. You're real calm
and
comfortable.
Nice.
Yeah, we control the nerves. I always tell my patients, concentrate on being excited. We take care of the rest.
Right. Very good. Now, this glaucoma screening gets underway at 9 o'clock.
9 o'clock Saturday this week at our main office on Sherman.
Is it an appointment thing, or
Nope.
do people just stop
It's
in?
basically a free open house type screening.
Yeah?
You're there maybe about 10 minutes.
That's it?
That's it.
Wow.
Yep. It's not a full eye exam where we check for glasses. We do check your vision briefly. We'll check your eye pressure. If your pressure's within the normal range, one of our technicians will let you know. Doesn't look like there's anything, that you need to see the doctor for, but we will have 2 doctors on site. So if it is elevated, we'll have the doctor take a little further look.
Oh, that's cool. That is great. What other kind of events do you guys have coming up? I mean, you got something going on all the time.
Huge this year
Yeah.
is our 10th annual Run for Sight.
Okay.
It's always every year the Saturday of Labor Day. And it's down at Pure Marquette, which is a beautiful location, and it's a dog-friendly walk run.
Okay.
It is competitive, but it's wonderful.
Yeah?
It's just, yep.
Do you compete?
I help Jen run.
Oh, you do?
Run the show.
Okay.
So I used to walk it, but I'm not a runner.
I have an issue with walking and running, too. I mean, if I could do that run in a golf cart, I'd be in a New York
Bring
minute.
one down. I'm sure there's something we can find for you to help us.
Yeah, they wouldn't mind at all, would
No.
they? Well, let's go over it again. It's a glaucoma screening this Saturday at Shoreline Vision. Gets underway at 9 o'clock, goes till 1. The address is,
1266 East Sherman.
And everything you guys do is right there on one campus, from your surgeries to your exams to everything. It's all right there.
Yep, we do have 6 other locations, but all of the screenings are usually held at our main office.
Comes to
Sherman.
the home office. Mm-hmm. And if there's a number that people want to call?
That would be 231-739-9009 or our website, shorelinevision.com.
Well, I'll tell you what, we'll put this all up online in Muskegon Radio, too. We wish you the best. I think it's and again, I talked about how much I've been treated like, I'm just a regular guy. I get treated like $1 million customer every time I'm in there. And I would say anybody that needs anything with their eyes should go right to Shoreline Vision, to say the least. Especially when you do all these great things for the community, like these screenings and all the different tests and stuff like that. You're a good member of the community.
I'm very proud to work there. It's
Shoreline
a fun company. Thank
Absolutely.
you.
Shawn Cook from Shoreline Vision. Again, that screening is this Saturday from 9 to 1 at their office on Sherman. We'll put all this up online at MuskegonRadio.com so you can get all the news. Have a great day, Shawn. Thanks for coming in.
Thank you.
There she goes. Holiday for Madonna. It is on Muskegon's 100.9. Get those eyes checked, would you? We want to keep you at least able to tell what radio station you're tuning into, right? 100.9. It's Holiday. Thanks for tuning in.